Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Kindly like, subscribe and share for more. Your elbow is a pretty amazing joint, isn't it? It lets you bend and straighten your arm, reach for things, and so much more. The pointy bone at the tip of your elbow, the part you might lean on, is called the Olecranon. It's actually part of one of your forearm bones, the ulna. When this bony tip breaks, we call it an Olecranon fracture. This type of fracture is quite common, unfortunately. It can happen to anyone at any age. Understanding what it is helps us figure out how to deal with it. The strong triceps muscle, located at the back of your upper arm, attaches to the Olecranon. When your triceps muscle contracts, it pulls on the Olecranon, and this action straightens your elbow. So if the Olecranon is broken, this movement can become very difficult or even impossible. It can also be incredibly painful. One of the most common ways is through a direct blow, like falling and landing right on the point of your elbow. Another way is through an indirect injury, like falling on an outstretched hand, causing a forceful contraction of the triceps muscle. If you've unfortunately fractured your Olecranon, you'll likely know something is wrong pretty quickly. The most immediate and obvious symptom is usually sudden, intense pain right at the tip of your elbow. This pain might get worse if you try to move your arm or if you touch the injured area. Swelling around the elbow joint is another very common sign. You might also notice bruising developing around the elbow. You might find it extremely difficult, or even impossible, to straighten your elbow. Some people report a feeling of instability in the elbow, like it's not secure. In some cases, you might even be able to feel a gap or see a visible deformity at the point of the elbow. Doctors classify Olecranon fractures into different types, which helps guide treatment. One type is a non-displaced fracture, where the bone has cracked, but the broken pieces are still in their normal alignment. Then there are displaced fractures, where the broken pieces of the Olecranon have moved apart from each other. An open fracture, also called a compound fracture, is when a piece of the broken bone pokes through the skin. If you've had an elbow injury and suspect you might have an Olecranon fracture, it's really important to see a doctor as soon as possible. Don't try to just walk it off or hope it gets better on its own. A proper diagnosis is the first step towards getting the right treatment and ensuring a good recovery. When you see the doctor, they will start by asking you questions about how the injury happened. They'll want to know the details of the fall or impact, and what symptoms you've been experiencing since the injury. Next, the doctor will perform a physical examination of your injured elbow. They will look carefully at your elbow, checking for obvious signs like swelling, bruising, or any visible deformities. They will gently touch, palpate the area around your elbow to pinpoint the exact location of tenderness and pain. The most common and effective way to confirm an Olecranon fracture is with an X-ray. X-rays can clearly show if the Olecranon is broken and the exact location of the fracture line. Usually X-rays are taken from a couple of different angles to get a complete picture of the injury. In most cases, X-rays are sufficient for diagnosing an Olecranon fracture and planning treatment. Once an Olecranon fracture is diagnosed, the next step is figuring out the best way to treat it. Treatment depends on the fracture's type and severity. Non-displaced fractures often heal with a splint or cast. Displaced fractures usually require surgery. Surgery aligns and secures the bone fragments. Techniques include tension band wiring and metal plates. Rehabilitation is crucial for recovery. While most people with Olecranon fractures heal well with appropriate treatment, it's important to be aware of potential complications that can sometimes arise. One of the most common issues after an elbow injury is stiffness. The elbow joint is prone to becoming stiff after being immobilized or after surgery. Persistent pain can also be an issue for some individuals. If metal implants like wires or screws are used in surgery, they can sometimes cause irritation. There's a risk of nerve injury, particularly to the ulnar nerve, which runs very close to the Olecranon. Infection is a risk with any surgery, and it's a particular concern with open fractures where the skin is broken. Sometimes the bone may not heal properly. This is called a non-union, or it might heal in an incorrect position, which is called a malunion. Now let's talk about prevention, because avoiding an injury in the first place is always the best strategy. Since many Olecranon fractures result from falls, taking steps to prevent falls is really important. Make sure your home environment is safe. Keep walkways clear of clutter, secure loose rugs, and ensure good lighting, especially on stairs. If you participate in sports or activities with a risk of falls like skateboarding, rollerblading, or cycling, Consider wearing protective gear, including elbow pads. Always seek medical advice for proper diagnosis and care. UMCC, your ultimate medical consultants connectors.